Hello, my name is Balanibi Olabiodun. I'll be performing the skill video of IV incision and IV takeout. I'm in my appropriate attire in school. These are my equipment. I have the IV needle, the tourniquet, and everything. All the supplies are, are open to purposes. But before I start, I'll check my patient and do my hand hygiene, and I get my gloves. I set everything up. I've already checked my patients to check the name and everything. I got everything set up here. My patient here is Mrs. Smith. She's here to get IV fluid, so she's going to get a 20 gauge 1-inch needle. All right, I'm gonna bring all this out and prime my tubings and attach my tubings to the. I'll move the other hand and unclamp, and I'll prime my tubing and see. Now I'm gonna prime my tubings a little to see. Yeah, tourniquet. I'm gonna bring out the tourniquet to. When applying the tourniquet, I'll make sure that it's inches above the incision site. I'll make sure I tie it, and I'll make sure that I make it tight so that I'll see if the distal pulse. Next, I'm gonna clean my site with the alcohol swipe, and I'll be making sure that everything is clean in a circular motion. Then I dispose. When I'm inserting the needle with the patient, I'll make sure that the bevel is up, and I'll make sure it's 1 inch below the incision site, and I'm going to put it in like a 30-degree. I'm going to apply for first cut and get the level out and make sure that it's 1 inch in, and I'm going to remove the catheter here. Yeah, and put the vein in. I'm supposed to press this white thing to remove the needle, to put the needle back in, but because of remediation purpose, I'm not going to do that because of the remediation. But in real world, I'm going to press the white thing here and push the needle inside. The needle will go into the tubings, and I'll put this into my sharp container. I'll secure the IV here. Then I'll remove the tourniquet. Then I'll put these tubings in. I'll unclamp. I'll draw back to check for blood returns. And when there's no blood, then I'll push in the slining slowly in. I'll push it in slowly. After pushing everything, then I will clamp the tubings. I'll clamp. Then I will stabilize the tubing. I have to stabilize the dressing. In the real world, I'll take this out. I'll put it in here. But I'll put it here on top of the needle like this, on top of the ivy. Then I'll come on the side and put it in straight. After doing that, then I'll put this in my trash, and I see that everything, the tourniquet is well opened because it's not there again. And I'll take out the white sticky part here. I'll label everything with my name, my initials, that which is BA, the date and time, and the size of needle that I put it into the gauge, 1-inch needle. And right now everything looks good and everything is good, and I'm going to dispose my tourniquet and dispose some of the things that I need to dispose here. I remove my gloves. I put them into I do the hand hygiene. Now I'll be taking out the needle, the ivy. Then right now I'm gonna wear my needle, while I'm doing that, I'm going to remove this slowly. I'll be removing it slowly. And dispose it, the sharp container. Then I'm going to look into it and see that everything looks good. Then I will look and I'll cover it like this. Bring it out, and I'll make sure that this is good. It's still 1 inch, it's good, it's inside. Then I put a little pressure on this to make sure. I put this in the sharp container and put the pressure on it for like 30 seconds. Then I'll check if there's blood coming out. There's no blood. Then I put back in, and I put another one here. I put a pressure on it. Then I tape, and I put a tape on it and make sure everything looks good. No edema, no any redness. I make sure, Miss Smith, are you okay? Anything I can do for you? Then I will take off my gloves and pack on my do my hand hygiene. Then I exit the room. Thank you.